We are so pleased today to have with us Dr. Trikamjee, a doctor. He is a specialist pediatrician and certified allergist, and he serves on many boards globally as well. And welcome today. I'm just going to hand over to you for a bit of an introduction.
Hi, thank you for having me on your channel. It's such a pleasure. It's the first work piece I'm doing for 2026. So hopefully it's going to be the start of a very good talk and to many more. I'm very pleased to be here, and I'm very pleased that health and lifestyle groups, if I can say, are now starting to delve into getting to the nitty-gritty of the true science around allergies. I think it's such an important topic. I think that it's something that's so common in terms of its presentation and its prevalence, but I think it's also something that's so poorly understood. So hopefully this is going to help lots of people. And like my background, I'm a pediatrician first, but I'm also an allergy and immunology specialist. Thank you for having me.
Perfect. So let's jump right in. What is your main focus areas in medicine, and what led you to choose these specializations?
So I'm a pediatrician, and that's my specialty. I did that as a specialty. And I had sworn that after I was done with this, I was not going to study anymore. And I just got this opportunity. I'm originally from KwaZulu-Natal. I got this opportunity to do the subspecialty, this fellowship in allergy and immunology, which honestly, I was not even aware existed because it is a new subspecialty in South Africa. And I was a bit undecided originally. Because I didn't know it existed, I didn't know too much about it. And I think that's quite an important fact. I was a specialist pediatrician practicing in South Africa, and yet I knew nothing about allergies. I didn't know it existed as a subspecialty. When I started it, when I decided to accept this post, it was through a foundation that I got this award. I never turned back. I never looked back. It was something that I so truly enjoyed. And honestly, I didn't realize until I got into it that allergy was so vast and there was so much to it. And then, of course, I did a 2-year fellowship in allergy and immunology in pediatrics. And I also did a bit of adults. I wrote the exam in pediatrics and adults. And that's why people are often confused because I'm designated a pediatrician. A 30-year-old would often think I can't go to her with my allergies because she's a pediatrician, but I have done adult exams and so I see adults as well. And then I went overseas. I went to do the exams in Europe as well. And yeah, and then my love just grew and grew. I then got involved in research, and I just find it to be an immensely fascinating field. The second part of your question, which is important for patients in terms of what it means for them, is asthma, allergic rhinitis, which we commonly refer to as sinus or hay fever, food allergies and food intolerances. And there's a distinction. People who have an immediate reaction to something and are worried would be a food allergy. People with a lactose, gluten intolerance, those are all things we specialize in. Immune-related conditions, patients with eczema, which medically is referred to as atopic dermatitis, which often comes from an allergy in your skin, and urticaria. Lots of young women your age struggle with random spontaneous itchiness that they get. So those are my fields of interest.
Oh, there's so many questions I have for you now. So can you tell us some stats maybe about allergies, especially with regards to South African women and children?
So, we honestly, we don't have hard stats. I'm going to answer this question a bit loosely.
Yes.
There's global stats on asthma and allergic rhinitis. And obviously, because it's a more established field in developed countries, there are hard statistics on it. Again, in terms of hard statistics, you're looking at almost 20% of the population that suffers from asthma. And with allergic rhinitis, it goes up to 30%. Some countries even say 40%. And these are some EU studies. Again, a lot of research shows that there's a lot of people with perhaps allergic rhinitis who are undiagnosed. So whenever I speak of statistics, I often say that these are the numbers we know and these are the numbers that are counted. But of course, there are millions, if not billions, of people who live with allergic rhinitis, who live with certain types of allergies who are not counted and don't know. So That's why I said I answered this question very loosely, because these are what kind of global statistics look like. But the numbers when it comes to allergic rhinitis and asthma are, in my view and in the view of a lot of allergists, much higher. Food allergy rates are lower, contrary to popular belief. So a lot of people think that there's a lot of food allergy in the world, and everywhere we go to parties, we go to social gatherings, you often see a lot of people reporting food allergies. So our perception is that there's a lot of food allergy in the world. But when we're looking at percentages of food allergy, you're looking at less than 5%. And that's why it's so important to get a proper diagnosis, because you want to know if you fall in that category so that you get proper management in either case.
Okay, perfect. So, in your opinion, what are the three most prolific allergies and can they be prevented?
Wow. This is such a brilliant question, but also such a difficult question to answer. I would say dangerous allergies that we can avoid. You know, there's a lot of research that we have now in what we refer to as a realm of allergy prevention. So, what we do know when we look at allergies is that generally children or people who suffer with allergies follow a trajectory. So, we call this trajectory an allergic march. And often we say this allergic march starts from day zero of life. So the day you're born, your immune mechanism and your immune cells, and often clinically, when I see a patient, I would ask a mom, did your child have cradle cap when they were born? Because research shows that at day zero of life, if they have cradle cap, it shows that they might have some dehydration and a slight start of eczema on the skin, and that starts this so-called allergic march. So the allergic march, it starts early, and because it starts early, the research on what can we do to prevent this? We know that it starts early. We know that adults don't just wake up one day and suddenly have eczema. Adults don't just wake up one day and have asthma. Usually what happens is when you dig deep into their childhood, there would be a history of my mom or my dad or my sibling or my aunt or my uncle had severe asthma or had eczema, or someone in the family might have had a peanut allergy or a life-threatening egg allergy. So all of those things form part of a picture. And when we talk about prolific allergies and prevention, in terms of prolific, each patient is different. So for us, some patients might have a controlled asthma and it's not so dangerous, but with some patients, asthma can be life-threatening. So I would say up there is asthma prevention. And another thing is food allergies. So because we're hearing so much about food allergies now, and coming back to how I explained the allergic march starting with your skin and with your eczema, when we know in terms of prevention, when we know there's a baby who might have these type of allergies, I generally as a pediatrician would advise that mom that, look, there is a risk of food allergies in your baby. So we want to start early, and the starting early starts with introduction. So initially the introduction, if you've already seen the mom and the baby's born, the introduction will start when we start weaning the baby onto solids. And popular belief now, and research has proven this, is that we should start weaning babies onto allergenic foods from 4 months of age, because this is when their immune systems are kind of adaptive and have the ability to build antibodies and be tolerant rather than allergic. But we now also have more data about pregnant moms. So all those pregnant women who are watching your podcast, if you know that there's a history of allergies in your family, there's no such thing as one allergy is worse than the other. Like I said, every patient is different. But if there's a history, then what you can start doing early as in your pregnancy is make sure you get enough peanuts, make sure you drink enough cow's milk protein, get your wheat in, get your eggs in, because what you're doing is you exposing a naive developing immune system to these foods. And when your naive developing immune system is being exposed to these foods, it's now learning to adapt to be tolerant rather than be afraid of these foods and the environmental things. And another interesting thing that might tie into your question as well is the farm hypothesis, or what we refer to as the hygiene hypothesis. This is how we came about with the idea that exposure is better and avoidance is worse. Children who are born in farm environments or live in farm environments, running barefoot, drinking water from the rivers and eating fresh off the ground, living with animals and chickens and roosters and cows around them, have healthier and stronger immune systems. it's commonly believed that, and it's been proven, than children who live in environments where it's very industrialized, it's urban. We clean, we're using, unfortunately, after COVID, yeah, and unfortunately, after COVID, we couldn't tell moms not to do this, but frantically cleaning your hands and making sure our kids are washed. I know you've done a lot of research in this. An interesting study called the Parsifal study was done among the Amish community. And the Amish community, who live completely natural lifestyles, have zero allergies versus the rest of us. Warn moms who are listening to this podcast, this doesn't mean that we suddenly go into a mode of, because that's also become fashionable now, of my child must never have any drugs, no salt, no sugar, a completely natural lifestyle, because actually we cannot replicate what the Amish community are doing, because in fact your child is growing in a normal environment. Your child is sitting in a car that emits carbon atoms. We are living in a world where there are buildings around us. We are consuming things that are made in factories, whether it's our clothes or it's our food. So, sometimes becoming too obsessive about trying to be natural isn't necessarily going to be the greatest thing, because what we need to do is adapt and do what's the most important to make healthier immune systems in the current climate, if that makes sense.
Sense. It makes perfect sense. Okay, great. What are the biggest misconceptions when it comes to asthma specifically?
So I think a lot of people, the first thing is people have this misconception that asthma is a bad word. Often when I see patients the first time, I honestly, even when I'm almost confident that this person does have allergic asthma, and I'll get to that, does have asthma, I wouldn't use the word asthma, because I know it's a scary word. It's a scary word for a mom to hear that your kid might have asthma. And it's a scary word for a person, even if this person's coming to see me and they've been wheezing for months, they're unable to run without coughing or becoming breathless. They're being woken up at night by a cough or a wheeze. Still, if I use the word asthma, it's kind of scary. So often I would examine their lungs intensely. I would do a lung function for them. I would sit down and explain to them about what happens to your bronchi and manage them first. And then when they come back and they're better and they're able to digest that they need this medication has made a difference in their lives, I then start using the word asthma. And, it starts with what asthma is, because I find as a misconception, a lot of people are afraid of this word because in the past it was associated with a lot of deaths. It was associated with being hospitalized, needing oxygen. It's associated with needing to hold a pump in your hand all the time. And so I think a big misconception is a lot of people are very afraid of that word. You get all forms of asthma, and if you get the right diagnosis, if you get the right treatment, you can live a completely normal life even with that background of asthma. Some patients don't even need to use a pump for their asthma. And especially in children, when they're given inhalers or a pump to use when they're younger, whether or not you told your kid has asthma, it's important because we can prevent it. So we also do what we call asthma prevention. Another common misconception I often see is that if you keep using your treatment, then it's bad. If you keep using your treatment, then it means that your body is going to get used to it and your body is going to stop reacting or responding to the treatment. That's also a misconception we hear. If your treatment's not working for you anymore, it means you need to be assessed by your doctor and some treatment might need to be changed. But it's never harmful to keep using your treatment over and over again. That's a big misconception. And a lot of people, with asthma, I could go on and on, but I'm thinking about the ones that would impact your audience the most. People believe that if you have asthma, you shouldn't exercise. That's also a misconception. If you have asthma, for example, swimming is good. Our lungs have a lot of muscular tissue. There's a lot of muscle tissue in our lungs. And our bronchi, which are the pipes in our lungs. And I often like to use the word with patients, I say it's like a plumbing system. When those pipes are slightly blocked, that's why you might get breathless or you might get that sensation of wanting to cough. We want to open them up. And because all of these things have muscle tissue, when we're exercising, we're actually helping it and we're making it better. So these things might actually assist. And I'm not sure if you yourself have any misconception that you'd like to clear out or, that you might have.
No, I must be honest. If there's terminology or names given to something, I always judge it on a case by case basis. It's like it's very specific to the person. So to blanket something, I'm always wary of doing that.
Literally, yeah. The word
Yeah,
asthma is no longer a scary thing, but it's also a very important thing. You want to get the right treatment because we take asthma very seriously.
yes. So in your opinion, what three areas need the most support in South African pediatrics?
Oh wow, pediatrics. Okay, so
Yeah,
I think neonates from young. So, I could break this down. I'm going to be very brief with this answer because with my subspecialization in allergy now, I do a little bit of pediatrics, but not too much. And obviously, it's different in the state sector and it's different in the private sector. So in the
yes.
private sector, we really want to harness the quality, and we want to get more and more subspecialists because that's a priority. I think that we should get more subspecialists everywhere, whether you're in private or you're in public. But like I said, with allergy, it's a new subspecialty. So there's very few people who are accredited subspecialists and who are able to really delve into the nitty-gritty of the immune system and understand what's going on in the life of a baby so that they can not just diagnose, but really work with the mother to practice prevention. And I'm pretty sure it's like that in all other subspecialties, whether it's pediatric gastroenterology or cardiology. Genetics is a big field now because there's a lot of prevention that can be practiced with that. The state sector, unfortunately, because there are issues that are more pressing, malnutrition, for example, which is something that we do still see. There are still people who can't afford healthy diets for various reasons, depending on your background. So, I think really getting in pediatrics, proper education on nutrition. I always think that's a win. That's something that you see in the public sector and the private sector. We're seeing obesity being an issue in the private sector now as well, and that all goes into the field of nutrition. So, really injecting resources, money, and education into moms truly understanding how important nutrition is when you're pregnant, how important nutrition is whilst you're breastfeeding, really how important breastfeeding is in itself, and how important giving your baby the correct foods at the start is. And I'm just going to add a little thing in there with my allergies is exposing your baby to a variety of foods, not necessarily just feeling that only natural foods are necessary. Exposure to everything is necessary. Exposure to your tartrazins and your MSGs and all those things are necessary. I think the proper education and getting the proper people out there who could provide this education is really, really key. And, it's not such a big thing anymore, but our communicable diseases in South Africa, in developing countries, is obviously a big thing. When we say communicable, I know you would know what it means, but it's
Yes.
things that are passed through by infection. So, we saw a big consequence of that with COVID-19. But, right now I'm seeing a lot of gastro, and I'm sure a lot of mums who might be watching this podcast right now will be nodding their heads saying, my child had it and many other kids have it. So, really dealing with communicable diseases in terms of prevention. Number one is the vaccinations. Campaigning of that is done pretty well. The World Health Organization is very good with that. But really getting the proper care, I think, in rural areas so that we're not passing, severe diseases such as TB, but
Yeah.
also mild things such as your strep throat and your common flu and your gastro.
Absolutely. Okay, perfect. Can you chat to us about dermatitis and eczema in children? What are the causes and symptoms, and how can they be managed?
So this is one of my favorite things to speak about because it is a misconception. A lot of people think that the skin is just a covering on our body. And so when I have a rash, I go to a skin doctor and I need to change my creams, or I need to take creams to treat this. Eczema goes way deeper than your cutaneous top layer of your skin. So, your skin is actually an organ. Everyone knows it's the largest organ in the body. So it needs to be treated like an organ. It's as important as our heart, our brain, and our lungs. The skin is actually an organ that's in our immune system. So our skin reacts to immune things. And Eczema is extremely common. I've already mentioned how it's the start of the allergic march or the atopic march. The medical term for eczema, and people who struggle with eczema would have heard this, is AD or atopic dermatitis. And atopic literally translated means allergic. Dermatitis means inflammation on the skin. So if you look at when the term atopic dermatitis was coined, when eczema was discovered, and probably going back decades or centuries, I'm honestly not sure. But they were aware then that there was an allergic component to this. So if we're treating eczema just by a cream on the skin, often cortisones are prescribed, which is a mainstay of management when used correctly. But it's also important for a patient to know what's causing the eczema. So if you're itching a lot and you're constantly itching, if you could buy the best cream on the planet for your skin, right? And if you would lather it on your skin, if you are potentially allergic to a cat or cats, and you're living with 7 cats and your cats sleep on your mattress, every night when you go lie on that mattress, you're going to itch insanely. And then you're going to take your fingertips and you're going to do this on your skin. So firstly, that cream is off. Most of it is not going to work. You're going to spend all night scratching. So you're going to constantly aggravate and irritate your skin. And then you're never going to win with your cream. So it's important to treat your eczema systemically from inside the body, not only on the outside. And the way we do that is taking a good history. If a person says to us that, I also do have a history of asthma, or I get chesty, or I have symptoms of hay fever, when we examine them, we check for all of that. We know that potentially this person might be having eczema because they have an environmental allergy. If a person says, I itch insanely at night when I'm lying on my mattress, so when I wake up in the morning, sometimes I've seen blood on my sheets, that person potentially might be allergic to the pets that sleep in their home or to dust mites. Now you're getting to what's causing this person's eczema, and now you want to treat this person's eczema better. And then we get into, and I don't want to go into too much detail of that, but then we get into managing, okay, well, how best can we manage this person's allergy as well as their skin? Because now we're not only treating their skin with a cream, we're not only applying an emergency therapy and treating the symptom, we're also treating what's in fact causing it and the root cause of it as well. So it's something I see a lot in my practice. I see a lot of patients who've been struggling with their skin for years. They have good seasons and bad seasons. Often patients say, I had eczema when I was an infant or in my childhood. Somehow, somewhere along the line, I grew out of it. And it came back when I was an adult. And people have all sorts of questions for that. People often want to know, but why does it come back? But that's, the climate, the exposure, where you live. It's just how our immune system adapts and how our immune system moves. So we do have a lot of novel therapies for eczema now, apart from treating, if you are allergic, treating the actual allergy. But we also then have something which we refer to as precision medicine in immunology and allergy, where we target the exact cells that cause the allergies and drive the allergies. So, we don't only treat the itch or the scratch or the inflammation. We have injections called biologics. And so it's a very exciting thing. And I think the take-home message in all I've said is that your skin is not just at your surface. Your skin is an organ. We treat it as such. When you have eczema, there's a lot more going on than at the surface. We want to treat you as a person. We want to treat your itch. Your itch is as important to us as the eczema itself, because that has caused and does cause a hectic deterioration in a person's quality of life, just the itch alone. So managing your eczema holistically is extremely important.
It's so true, to get to the root and sort of a holistic care management system. Okay, perfect. So what does a healthy immune system look like to you?
So a healthy immune system, I think it can be very much like you said earlier, how different people, it's an individual scenario. I think it's dependent on different people. It's dependent on the environment you live in. I think ideally we would all want an immune system that never gets sick, but that doesn't happen, right? I think that's a wish for most people, is why do I get sick? I don't ever want to catch the flu. But I think a healthy immune system does actually get the flu. A healthy immune system does get the common cold. A healthy immune system will get exposed to bugs. But I think the important thing is the healthy immune system knows how to tackle all of these things. So when
Yes,
we're children, we often want the kids to be exposed to the bugs because we want them to build up healthy soldiers or antibodies against these bugs. So the healthy immune system is not naive. The healthy immune system has experience in dealing with things in the environment, and that would include all of your bacterial and viral and fungal infections that we're exposed to on a daily basis. But your healthy immune system wouldn't make you sick of it. It would make sure that if you got it, you might get a few symptoms, but it would not be bad enough to land you in hospital or interfere with your work and your daily activities of living or your quality of life itself. I don't know if I've answered the question. I don't want to go into, because I often get questions from moms about specific numbers in your immune system. You know, a lot of people, because there's Google and TikTok now, and there's podcasts such as yours, we are giving people correct information, but there's a lot of information out there, and I think it's an information overload. So people are often trying to go into, I want numbers. You know, people want instant gratification, so they want that black and white. So, you know, I've seen patients where they've spent tens of thousands of rands on testing their immunoglobulins or testing their immune levels on their blood, just because they were worried and they wanted that number to be okay. And so, yes, when we as doctors assess, there are levels that we look at to determine an immune system, and it starts all the way from something as simple as your white cell count, and then we delve deeper into it. But all of those things have a time and a place. They're done for
yes.
a specific reason. They're done when we're looking for something. They're done when we're considering a pathology, not in a healthy individual. I think if your immune system from childhood is exposed and then knows how to handle everything around them that life throws at you in terms of infections, bacteria, bugs, environmental allergens, and knows how to deal with it, for me, that's a healthy immune system.
Perfect. And also the next question you've actually answered already, because I was going to ask, how does an adult, say a mother and child, build that? And it's all down to exposure.
It's down to exposure. It is down to exposure. And I think it also ties in with the question you asked me about healthcare and what's needed and so important is nutrition. You know, we undervalue, there's a lot of supplements on the market, and a lot of people are always asking which one to use and which one not to use. And nothing supplements a healthy diet. So if you have a good, healthy lifestyle, and you're being exposed to all the food groups and the food types in their natural form, as natural as can be, supplement isn't always necessarily going to compete with that. That's always the best. And then on top of that, you now have got, if you need to, getting supplementation in. So, you know, with food allergies, there's a lot of negative, if I can say, press about dairy. A lot of people feel dairy is bad and dairy might cause problems in their babies or in their children. A lot of people are being told or believe that dairy can sometimes cause nasal issues, which is untrue. A dairy allergy comes from cow's milk protein, and either you're allergic to the cow's milk protein and it's going to make your entire immune system react, or not. And when we speak about healthy diet and healthy immune system, this is an important thing there. So I'm a vegetarian. I've always been a vegetarian. So I often say to the public and to patients is, if you're not having milk or dairy because you don't want to have it for either religious reasons or because you're a vegan, then that's okay. But don't not have cow's milk protein believing that it is bad or believing that somehow that is the problem of your allergies, because you're actually doing harm to your body. The amount of vitamin D and calcium that a growing child with growing bones and growing teeth gets and needs from cow's milk protein, and a woman our age needs, because we're prone to hormonal change, which makes us prone to osteoporosis and osteopenia in all forms of our lives. And that comes from these nutritional aspects being depleted. You know, it's important to make sure that we're getting the right amounts of nutrition from the right foods at the right times.
Yes, that's so true. So let's chat about food allergies, which you've just touched on now again. Sort of, what are some red flags for someone to go, you know what, I need to go see someone, and who is the first port of call for that?
Okay, so if you're concerned, I think how I should start is, does my child have a food allergy? Or do I have a food allergy? And a food allergy is an immune. So I'll save a lot of people a lot of money here, because a food allergy is an immune mediated reaction. It comes from your immune system. So if you're eating a food, the reaction is going to be immediate. It can involve your skin, it can involve your lungs, your throat, it can involve your cutaneous tissue. So you could get swelling in your eyes, you could get swelling of your lips, swelling in your tongue, and your throat could close up. Your blood pressure can get high or low, and that's because your cardiovascular system or your heart can be involved as well. You could lose consciousness because your nervous system gets involved. And these are all just general examples I'm giving, but these are all the things that can happen when you have a food allergy. Sometimes I notice that my nose gets a bit more runny when I drink a little bit more milk. That is not a food allergy, and that's a big problem and a big misconception in the world. That is not something that a true allergy specialist is going to do an allergy test for. An allergy test is done when on history we know this person's had an allergic reaction. Often when someone sees me the first time, on history, a good allergist is already going to know if it's positive or negative. Just on history, you're already going to know what this person's allergic to. The reason you're doing a test is A, for confirmation, B, because you want to see how severe that level is. So you can advise that person, you're so highly allergic, or your allergy might be mild and there's a potential in a child, for example, to grow out of it. And for monitoring purposes, because we want to now check to see, is this person's allergy getting worse over a period of time or years, or is this allergy getting better? Is this something that they're overcoming, especially in a child, so that they're going to reach a point where they're not going to be allergic anymore? So when you see a doctor, the allergy test is done for specific reasons. I always tell a patient, if I do a test for you, that test needs to change your life, meaning that that test should tell you for sure. It needs to give us information that we don't have. If someone comes to me and they're eating yogurt and they're eating cheese and they've drank milk their entire life, and I'm just using milk as an example, so we have a standard because it's quite common that we see this. And I have that all the time. But I'm sure I have an allergy to milk because every time I have milk, I get bloated, or I'm sure that the milk is causing my hay fever or my sinus issues. I already generally know with almost a 99% certainty that this person isn't allergic to milk. So, that's where the first part of your question comes in, is when you have a food allergy, it is important to see an allergy specialist, because you might end up, if you're worried about a food allergy, if you go to a lab or you go to a general doctor, just do a whole bunch of tests that might cost you a lot of money. Sometimes can be just told to you just on a history. You don't necessarily need to do a test, but now you're going to do a test. And often interpretation and an allergy test is key. So if an allergy test is poorly or not correctly interpreted, that can give you a false positive result. Allergy tests are not as simple as yes, milk is positive or no, milk is negative. Yes, peanut is positive or no, peanut is negative. It's not like that anymore. We go down into the proteins within the milk and the proteins within the peanut, which we know can cause an allergy. And often something turns up positive and the lab can flag it. And then you have a problem where a doctor sees it's positive and a patient sees it positive. And now you see a patient who is avoiding a food, believes they're allergic to a food. It's caused such a bad problem in their quality of life because now they're reading labels, and every time they go to a restaurant, they're afraid of a food, but they were never allergic to a food to begin with. And this is why seeing the right doctor at the beginning is so important, not just if you believe you have a serious allergy, but seeing a right doctor if you know that I'm concerned about this. Because very often, if you see an allergy specialist, they might send you off without even doing an allergy test. So now you found out that you're not allergic to something and it's costed you no money doing that allergy test. I laugh with my patients. It might cost you to see the specialist, but doing the test, we only test what's relevant. We actually advise healthcare workers all around the world, do not test unnecessarily. Do not do panel tests unnecessarily. Do not do a test just because a patient has requested it. Rather speak to a specialist first so that the right test can be done for the right patient and it can be done at the right time. And it causes an improvement in that person's life rather than a decline from avoiding something unnecessary.
Okay, perfect. So you've already actually answered how diet impacts health. So I'm going to go to the last question. In your opinion, what type of movement most benefits a woman with all of
Movement.
this in the background?
I suppose because you're a wellness hub, women would want to know this. So, I think, look, with food allergies, generally, movement wouldn't impact you. But
No.
I think since we were talking about asthma,
Yes.
movement is important. So I've had a few patients, and this is by no means because honestly, the specialist does not always know everything. I'm the first person to admit that I learn from my patients all the time. I have patients who are yoga teachers, and I have patients who do Pilates, and I've worked with them where they use their asthma medication, but over a period of time, these patients with regular yoga breathing techniques have really improved their lung function. So every time they see me and we do their lung function, it has drastically improved. I've realized when I compare that person who does that type of breathing exercise versus the same type of diagnosis and age who doesn't do the breathing exercises, I do notice there is a difference. So, all of these things do impact us because, again, our body must be treated holistically. Our body is a whole. A lot of people, when they're asthmatic, are afraid to exercise because initially they've had a fear, an episode where they couldn't breathe or their chest got tight or they cough. With kids, they often get laughed at or they can't perform in sports or in athletics when they're asthmatic because they get breathless. So they then tend to stay away from it. But I find that if you're on the right treatment and your lungs are controlled, obviously be on the right treatment. I don't want people to go out and try to push themselves and then have an emergency. Once you're on the right treatment, and I often would do a lung function for them when they see me, and I would say, I think it's okay for you to exert your body a little bit more than normal. And then I have patients who do their yoga and Pilates, and I've seen a world of difference. Swimming is incredibly good for asthmatics as well. So a lot of young kids who are wheezers or asthmatics, I tell the moms and dads, let them jump in the pool. So long as somebody's watching them, because we never want an emergency in the pool, so long as you have your emergency inhaler with you to prevent any problems, you know that you're safe, get into the pool because you're swimming in the pool at different pressures versus the pressures that we're inhaling in dry air. So all of those things, I think movement in general, those are the ones I know would specifically impact asthma, but I'm a big fan and a big advocate for movement. And I'm sure that some of your listeners would have other ideas. And I'm open to people even telling me about experiences they have. It's a
Yes.
learning school and we're learning every day. And like you and I have both mentioned, every patient is completely different. So, I learn techniques and I learn things from my patients when it comes to some of the natural ways that they've assisted. By no means am I saying you must only use this to treat your condition, but these are definitely things that enhance. And I have been able to wean patients off treatment when they have looked after themselves better.
Okay, great. Thank you so much. I just want to check, are there any upcoming events or workshops or collabs that you're going to be busy with in the next month or so? And how do people contact you? Through your Instagram, or what is easiest?
So, in terms of the collabs, there are a few, but I'm not allowed to say right now
Oh,
towards
okay.
the year. But I think it's very easy to get hold of me. I'm at the UCT Lung Institute Allergy Immunology Unit. If you just get onto our website, I'm happy to share my email address as well. So my email address is thuljat@gmail.com. And a patient can email me because I do see patients from, I'm going to say all parts of the world, actually. So, you don't have to be in Cape Town. We manage patients from absolutely everywhere. I do see patients in Johannesburg on occasion as well at Sunninghill Hospital. And yeah, they can contact me on Instagram. A patient can just DM me if they want more details in terms of wanting to book an appointment or just to ask whether it would be necessary. I am not here to get patients to do allergy tests and see allergists. Patients need to see the right doctor at the right time. And often it's just a question. Patients will say, this is my story. Do you think I do need to come in and see you? And sometimes I'm not quite sure And sometimes when patients tell me their story, I'm like, yes, you should have been with me 10 years ago. You have to come and see
Yes.
me. It's going to change your life. And yeah, we're always doing lots of media, lots of talks for patients as well as for doctors, lots of educational events through certain pharmaceutical companies, through wellness channels such as yourself, but also with industry. So, with babies, I do a lot of stuff with, and that I can mention with companies such as Purity, who I work with as a consultant, where we're constantly trying to educate moms from all backgrounds on, basic information, but correct information that can go a long way.
Thank you so much for joining us today. It's been an absolute pleasure to have you.
Thank you so much for having me.